Welcome to our video on the symptoms of multiple sclerosis. This video will cover 14 symptoms that you may have overlooked. What if the strange sensations in your body were actually warning signs your brain was in danger? Millions of older adults in America brush off odd symptoms every day. A hand that suddenly trembles, a flash of blurred vision, that strange tingling in the feet that seems to come out of nowhere. These may seem harmless at first, just aging, just being tired, just stress. But what if they are not? What if these everyday annoyances were actually early signs of a neurological disease that could slowly strip away your mobility, your memory, even your independence? Multiple sclerosis affects nearly 1 million Americans and close to 3 million people worldwide. Yet most people have no idea it is creeping into their lives until it is far too late. Why? Because MS hides behind common symptoms. It disguises itself as normal aging. It moves silently, damaging nerves in the brain and spinal cord, while people continue with their routines unaware of the storm building inside them. Here's the terrifying truth. If you ignore these signs now, you could lose precious time. And time is everything with MS. Catching it early could mean the difference between years of independence or years of painful decline. This is not fear-mongering. This is reality. But there is hope. In this video, we are going to walk through 14 powerful early symptoms of multiple sclerosis you must not ignore, each one explained clearly, each one backed by science. And most importantly, you will learn what to do next if any of these sound familiar. The fifth symptom might completely shock you. In fact, it is one of the most overlooked clues your nervous system is breaking down from the inside out. So stay with us, because your body could be whispering a warning, and today might be the day you finally hear it. Number 1, tremors. It often starts with something so small you almost miss it. You reach for a coffee mug and your hand trembles for just a second. Maybe it happens again when you write your name or button a shirt. At first you laugh it off. Just nerves, maybe too much caffeine. But is it tremors in the hands or arms can be one of the earliest signs that multiple sclerosis is silently attacking your nervous system. These shaky movements often come from damage to the cerebellum, the part of your brain responsible for coordination. As the protective sheath around your nerves breaks down, signals get scrambled. The result, uncontrolled shaking that can get worse over time. A 2023 study found that nearly 1 in 3 people with MS experience tremors. And for many, it starts subtly, but over time, it can make simple daily tasks feel frustrating or even impossible. Eating, writing, holding a phone. Every motion becomes a reminder that something is wrong inside. If you notice tremors, do not ignore them. Keep a symptom diary. Talk to a neurologist. Treatments and physical therapy can help reduce the severity and improve motor control. But just knowing this one sign is not enough, because the next symptom can strike suddenly with a sharp electric jolt, and most people have no idea what it really means. Number 2, electric shock sensations. So you felt a tremor. But then one day, you tilt your head forward and feel a sharp zap race down your spine. Just for a moment. Then it's gone. Weird. But what if that quick jolt was actually a powerful red flag from your nervous system? This is called Lermit's sign. It feels like an electric shock running from the neck into the back and limbs. And it is not random. It is often an early sign that the spinal cord is under attack from multiple sclerosis. The protective layer around your spinal nerves, called myelin, is damaged. So when you move your head in a certain way, it triggers a burst of confused electrical signals. A recent medical study confirmed that over 40% of MS patients experience this strange shock-like sensation often before any formal diagnosis. It is brief, but it is serious. If this happens to you more than once, speak to a doctor immediately. MRI scans can help identify nerve inflammation early. And early treatment can slow damage before it spreads further. But just knowing this symptom still is not enough, because the next warning sign is something millions of people live with every day, yet almost never link to their brain health. Number 3, chronic pain. After those strange shocks fade away, something deeper may start to settle in. A burning, a stabbing, a constant ache that never really goes away. You try stretching, you try rest, but the pain lingers, it shifts, it returns stronger. What if that pain is more than just sore muscles? Chronic nerve pain is one of the most overlooked symptoms of multiple sclerosis. Unlike a pulled muscle or arthritis flare-up, This pain is often caused by nerve damage deep within the brain or spinal cord. The immune system attacks the protective coating of nerves, sending faulty pain signals to the body even when nothing is wrong on the outside. A study published in 2023 found that 62% of MS patients live with ongoing pain, and nearly half of them suffer from nerve-specific discomfort. This kind of pain can also lead to fatigue, anxiety, and even depression if left unaddressed. If you are feeling pain that keeps returning without a clear cause, talk to a neurologist. Medications for neuropathic pain and certain physical therapies have shown promising results, but just knowing this symptom still is not enough. Because what comes next is not about pain at all, it is about something far more draining that slowly robs you of your energy and your life force. Number 4. Crushing fatigue. Pain can be exhausting, but what happens when the exhaustion hits before the pain even starts? Imagine waking up after a full night's sleep and still feeling like you ran a marathon. Your muscles ache. Your brain feels foggy. You have no energy to move through the day. This is not regular tiredness. This is MS-related fatigue, and it is one of the most disabling symptoms of the disease. It does not come from doing too much. It comes from the inside. Damaged nerve fibers in your brain and spinal cord work harder to send signals. That extra energy drain leads to an overwhelming sense of weakness and mental burnout. A 2024 study from PLOS-1 found that MS-related fatigue is linked to disruptions in brain regions that control energy and mood. And here is the catch. Even on days when other symptoms seem calm, this fatigue can strike hard. If you are experiencing this kind of exhaustion, do not brush it off. Ask your doctor about fatigue-specific therapies. Diet, sleep optimization, and certain medications can make a big difference. But just knowing this is still not enough, because the next warning sign is one people feel every day and dismiss as nothing, yet it could be the first sign that your nerves are breaking down from the inside. Number 5, numbness or tingling. Fatigue might slow you down, but what happens when your own body starts going silent? A strange buzzing in your fingers, a patch of skin on your face that suddenly feels numb, or your toes feel like they're asleep even when you have not moved for hours. Most people dismiss it, but they should not. This is one of the most common early signs of multiple sclerosis. When MS damages the protective layer around your nerves, signals from your brain get blocked or distorted. That is why you might feel tingling, burning, or total numbness for no clear reason, and it does not always go away quickly. According to a 2018 study published in Temperature, nearly 70% of people with MS experience numbness or tingling during their very first flare-up. For many, it was the first time they realized something deeper was wrong. If you ever feel unexplained numbness that lasts more than a day, do not ignore it. Keep track, write it down, share it with your doctor. Early imaging and blood tests can help spot MS before symptoms get worse. But just knowing this symptom is still not enough, because the next one can feel like your body is failing from the inside and it strikes where you need strength the most. Number 6. Muscle weakness. Numbness can leave you confused, but when your legs start to feel like cement blocks or lifting a grocery bag becomes a struggle, that confusion turns into fear. This is not normal tiredness. It is your muscles failing to respond the way they used to. Muscle weakness is a core sign that MS is interfering with how your brain communicates with your body, as the protective coating around your nerves breaks down the signals that tell your muscles to move become delayed or lost. The result, you feel heavy, slow, and weaker than you should. A study published in Frontiers in Physiology found that people with MS experienced up to a 60% drop in muscle strength, especially in the legs. Even when their muscles were directly stimulated, they produced less force. That means this weakness comes from both nerve damage and changes inside the muscle fibers themselves. If you notice increasing weakness in your arms or legs, especially without injury, speak to your doctor right away. Physical therapy, resistance training, and MS-specific medications can help you rebuild strength and protect function. But just knowing this one symptom is still not enough, because the next sign does not show up in your arms or legs. It appears right behind your eyes, and for some, it is the very first sign of trouble. Number 7, blurry vision and eye pain. Weakness in your limbs is frightening, but when your eyesight begins to blur or a sharp ache builds behind one eye, that fear becomes personal. Reading becomes harder, Lights seem too bright. Even colors may start to look faded. Most people think it is aging or eye strain, but it could be something much more serious. Optic neuritis is one of the earliest and most common signs of multiple sclerosis. It happens when the optic nerve becomes inflamed. This nerve connects your eyes directly to your brain. When it is under attack, the signals carrying visual information get delayed or blocked. A 2024 study in the Journal of Neuro-Ophthalmology revealed that over 37% of MS patients experience optic neuritis at some point, and for many it was their first noticeable symptom. The vision may recover partly over time, but without early treatment, it can lead to permanent vision damage. If you notice blurry vision in one eye, color changes, or pain, when moving your eyes, seek a medical evaluation immediately. A neurologist or ophthalmologist can order a scan to check for inflammation and begin early intervention. But just knowing this still is not enough. Because what happens when even walking across a room starts to feel like navigating a moving floor? Number 8, walking troubles. When your eyes begin to struggle, your body often follows. You get up from a chair and suddenly feel off balance. Your legs feel stiff, your steps become shorter, you trip more often, you start avoiding stairs, and deep down you know something is not right. Walking problems are a common and early sign of multiple sclerosis. As MS damages the nerves that control balance and coordination, your brain has a harder time sending clear instructions to your muscles. That miscommunication can make even flat ground feel uneven. A 2023 study in gait and posture found that over 60% of MS patients reported difficulty walking within the first 5 years of diagnosis. And it is not just muscle weakness. It is also about how your brain plans movement. The signals are delayed, the rhythm is lost, confidence starts to fade. If walking feels more difficult than it should, do not chalk it up to age. Early physical therapy and mobility training can dramatically reduce fall risk and help you regain control. But just knowing this still is not enough. Because what if the next sign is not physical at all, but quietly changing the way your brain thinks? Number 9, cognitive changes. Losing balance is scary, but what if you start forgetting things you never used to? You walk into a room and forget why. You struggle to find simple words in conversation. You feel mentally slower at work or while managing daily tasks. These are not just senior moments. Cognitive decline is one of the most misunderstood symptoms of multiple sclerosis. MS does not only affect the body, it affects how the brain processes information. As inflammation damages nerve pathways and shrinks gray matter thinking, speed, memory, and focus all begin to suffer. A 2020 study in the Lancet Neurology showed that cognitive changes can begin early in the disease even before physical symptoms appear. These changes are often missed or blamed on aging or stress. But in reality, they can be the brain's first cry for help. If you notice unusual forgetfulness or mental fog that does not improve with rest, speak up. Cognitive tests and brain imaging can detect early signs. And cognitive rehab and medication can slow progression when caught early. But just knowing this still is not enough. Because what comes next can make your entire world spin literally, and it often strikes without warning. Number 10. Dizziness and vertigo. Forgetting a word is one thing, but what if the room begins to spin even while you are standing still? You feel lightheaded, off balance, like the floor just shifted under your feet. Some people call it vertigo, others just feel drunk without drinking. Either way, it is terrifying. Dizziness and vertigo are common symptoms in people with multiple sclerosis. They happen when MS lesions affect the brainstem or inner ear pathways responsible for balance and coordination. That disruption causes mixed-up signals between your eyes, ears, and muscles. The result, sudden swaying, head rushes, a loss of control. A study published in BMC Neurology revealed that nearly half of MS patients report experiencing vertigo during flare-ups. These episodes often lead to falls or a growing fear of movement. If you feel unexplained dizziness or have trouble staying steady on your feet, talk to a specialist right away. Balance training medication and vestibular therapy can help manage symptoms and reduce risk. But just knowing this still is not enough. Because what if your body starts to ignore even the most basic commands like when to go to the bathroom? Number 11, bladder dysfunction. After your balance starts to betray you, the next loss can be deeply personal. You feel the urge to go, but the bathroom is 5 steps too far. Or worse, you cannot go at all. You start planning your day around restrooms, avoiding trips, skipping events, not from fear but from your bladder. Bladder problems are extremely common in people with multiple sclerosis. The brain tells your bladder what to do. But when MS damages those nerve pathways, the message gets scrambled. This can lead to urgency, incontinence, or even incomplete emptying. A 2019 study in the Multiple Sclerosis Journal found that over 80% of MS patients experience some form of bladder dysfunction within 10 years of diagnosis. And for many, it appears even before mobility problems. If you notice sudden changes in your bladder habits like going too often or struggling to go at all, talk to your doctor immediately. Simple urology tests and medications can help restore function and confidence. But just knowing this still is not enough. Because for many people with MS, the next issue is one they never want to talk about, but it affects their health every single day. Number 12, bowel problems. If bladder issues can limit your freedom, bowel problems can quietly take away your confidence. Constipation that lasts for days, sudden urgency with no warning, or worse, losing control when you least expect it. Many people suffer in silence. But this is more than just a digestive issue. Multiple sclerosis can interfere with the nerves that control your bowels. When those signals are delayed or disrupted, your body either holds on too long or lets go without notice. The result, unpredictable bowel movements that affect your daily life, your energy, and your emotional well-being. A 2024 study published in PLOS1 found that 73% of MS patients report bowel dysfunction, yet nearly half of them do not realize it is connected to their condition. Left untreated, this can lead to infections, inflammation, and even social withdrawal. If your bowel habits have changed in ways that affect your comfort or routine, speak to your doctor. Diet changes, hydration, pelvic therapy, and medication can offer powerful relief. But just knowing this still is not enough, because the next sign affects one of the most personal parts of human life, and it can silently break apart relationships if left unspoken. Number 13, sexual dysfunction. Few things are harder to talk about than this, but when physical intimacy begins to fade, it often leaves emotional distance behind too. Some lose interest, others feel disconnected from their body, many blame stress or age. But the truth might lie deeper. Sexual dysfunction is a common but rarely discussed symptom of multiple sclerosis. The brain and spinal cord control arousal sensitivity and response. When MS interrupts those signals, the result can be reduced desire difficulty with arousal or even painful experiences. A 2025 study from BMC Neurology found that around 70% of men and 50% of women with MS experience some form of sexual dysfunction. And it is not just physical. Mood changes like depression and anxiety, also common in MS, can make intimacy even harder. If this part of your life is changing in ways that feel unfamiliar or frustrating, do not suffer in silence. Counseling, open communication, and medical treatment can rebuild connection and restore confidence. But just knowing this still is not enough, because for many women in particular, the next warning sign strikes monthly, and it can make everything feel 10 times worse. Number 14, menstrual flare-ups. For many women living with MS, a predictable pattern begins to appear. Just before their period or during it, everything gets worse. The pain, the fatigue, the brain fog, even the balance. And it is not imagined. Menstrual cycles can make MS symptoms significantly worse due to hormonal shifts. As estrogen levels drop before menstruation, inflammation inside the nervous system may spike. This can lead to stronger flare-ups of existing symptoms or trigger entirely new ones. A 2018 study published in Immunology found that about 70% of women with MS experience symptom intensification around their menstrual cycle. The researchers link this to hormonal changes disrupting immune balance and nerve signaling. If you notice your MS symptoms flare during your period, track it. Keep a journal. Share it with your neurologist. In some cases, hormonal therapies or cycle-adjusted treatment plans can make a huge difference. But just knowing these 14 signs is still not enough, because recognizing them is only the beginning. What you do next could change the course of your life. We have just uncovered 14 early signs your body might be using to whisper that something is wrong, from unusual fatigue to strange tingling, or even changes in walking or vision. Some symptoms are easy to ignore. Others are brushed off as normal aging. But together they can reveal a much bigger story. If you recognized any of these signs in yourself or someone close to you, do not wait. Awareness is your first defense. Action is your next step. Speak with your healthcare provider. Take notes, ask for tests, trust your instincts, because when it comes to your health, early choices can lead to better outcomes. Living with MS is challenging, but living well with MS is possible. With the right knowledge and support, you can protect your strength, your independence, and your future. And we are here to help you do that every step of the way. In our next video, you will discover the top healing foods that help repair nerves and reduce inflammation naturally. It is packed with practical tips that you can start using right away in your kitchen. So please save this video for later and share it with someone who needs this information. You never know whose life you might change just by clicking a button. And if you want more trusted tips on aging smarter and living stronger, tap that subscribe button and turn on notifications. That way you will never miss the latest updates on senior wellness and nutrition. Your health matters. Your future is still in your hands, and it is never too late to take control. Subscribe, save this video, and take one small step toward a better tomorrow.